How you doing? This is Jim Fisher on the Third Way, not left, not right, America's Third Way. Today I wanted to talk about healthcare. I am probably going to have to do this in 2, maybe 3 parts. There is a ton to talk about. It's an extremely important subject that affects us all. To start off, I just wanted to talk about healthcare as a right. Is healthcare a right? Is it a right for you? Is it a right for me? Is it a right for everybody? Do you believe it's a right? I personally believe what's on the Declaration of Independence, that we have the right to life, liberty, and the pursuit of happiness. And each and every one of us as an individual has that right. And that phrase, pursuit of happiness, is actually changed a little bit. The original phrase came from John Locke's Trinity, life, liberty, and property. Property meaning the money you earn, the property you own, what you do with the money that you earn, how you exchange your labor, what is yours, your property. You can do with it however you wish, and it is yours and yours alone. Jefferson changed this to the pursuit of happiness, not because he didn't think property was a right. He meant it to include property. Your pursuit of happiness may be doing what you will with your property. Somebody else's pursuit of happiness may be becoming a doctor or a farmer or whatever. Choosing your own occupation may be pursuit of happiness, what your hobby is. Jefferson viewed pursuit of happiness as a more all-encompassing right, and that's why he changed it. Not to exclude property, to include property, and become a more all-encompassing right. So that's where that phrase comes from and why he changed it from John Locke's Trinity. So I personally accept this premise that we have a right to our life, we have a right to our liberty, and we have a right to our pursuit of happiness, or right to our property. To me, as a libertarian, property rights are one of the most important things we can have. It's what makes us a free society, is having a right to your property. If you don't have a right to your property, or the right to the sweat of your brow, or the right to your means of production, you are not free. You cannot be free if somebody else has rights to your property. Then they have a right to your liberty. So to me, that is the most important thing. To say that health care is a right, most of us aren't doctors, most of us don't produce health care. So to say that health care is a right is to say that you have a right to somebody else's production. And to me, I can't accept that premise. It's a very emotional argument. We don't want to see people without health care. I understand that. I'm not some evil guy that wants people to go without health care. That's not my point. I actually think in a libertarian society, way more people would be covered, and health care would be way cheaper and way easier for more people to obtain. But to say that you have the right to health care through redistribution of wealth is saying that I think the government is allowed to force somebody else through the threat of violence or the threat of jail, the threat of force. They must pay for my health care if I cannot afford it. That is not, so that is direct contradiction with property rights. Saying you have the right to health care is a direct contradiction to saying you have the right to your own property. You cannot say they're both true. They both cannot be true. Either one's true or the other's true, or you believe in some quasi-mix where we all have property rights unless somebody gets sick, and then they have the right to our property. Otherwise, you have to believe in one or the other. I accept property rights. Please think about that. Decide for yourself which one you accept. Do you accept property rights, or do you accept the right to health care? You can't accept both. It's a logical contradiction. So I'm going to kind of start with that. In the United States, we have a quasi-mix of free market and kind of socialistic healthcare system. It is mainly a multi-payer insurance type of system where most of us have insurance through our employers. That is bad because that is the direct reason we have inflated the cost and removed it from a free market system because of the tragedy of the commons. The tragedy of the commons is when you have multiple owners of property, each person will try to get as much of that property as they can. For example, if you said 4 of you own this farm and all that you can produce on it, each person's going to try to get as much out of that land as they can. They probably won't take care of it. They probably won't make sure the soil's fertilized for the next year, because they're going to get as much out of it as fast as they can, because they know if they don't, somebody else will. That's the tragedy of the commons. Insurance brings the same thing. When you buy health care with your insurance, you do not care what it costs. You only want the best insurance, the best health care that your insurance provider will buy for you, because the cost is being absorbed by other people. And of course, other people are thinking the same thing with the money that you're putting in it. They want to get the best health care they can that insurance will allow them to provide. This is the reason our health care cost has gone massively higher than the cost of living increases. The reason we went to an insurance type of industry is because back after the war, we were going through a massive inflationary period where the government, or actually not the government, the Fed was printing a ton of money. We had to pay for the war. We had massive debt that had to be paid for. So we were going through a massive inflationary period because of the amount of money that the Fed was printing. This resulted in extremely high inflation. The decade of the 40s was a double-digit inflationary period. So companies, to attract talent, had difficulty because higher pay, all companies were offering higher pay, and attracting talent was very difficult. Because of such a massive inflationary period, offering higher pay was easy to do, and all companies were doing it. So certain companies started to offer health insurance. They said, you know what, well, people aren't really that interested in money because money's buying less and less and less each and every year. So they want the things that they can buy with money, and one of those is the security of health care. So companies started to offer insurance. So this is an indirect result of government policy of massive inflation through the Fed's printing, and indirectly caused companies to start providing insurance. Prior to that, we were for the most part, a free market system. Healthcare technology was moving in leaps and bounds, major advances in medicine and surgery. So in a completely free market system, we were doing very well. We continue to do very well because the insurance doesn't so much hurt the healthcare industry. It profits massively from insurance because healthcare actually rises much higher than the cost of living. So the healthcare industry gets massive injections of money through the insurance industry. And insurance tries to control costs, but because of the tragedy of the commons for each and every one of us, that's very, very difficult to do. So that is kind of the general reason why we have insurance as kind of instead of a free market system. I mean, it's still technically a free market system. Any one of us can buy the health care they want. It's not an outright socialist system, but it is a kind of a quasi mix of free market health care and kind of socialistic insurance health care. Insurance isn't meant to buy everyday purchases like a doctor's visit or asthma medication. Those are not high-risk events. Insurance is supposed to cover high-risk events. You think there's a possibility you might get in a car accident or a tornado. Very unlikely, but when it happens, it's very high risk. So you pool your money together with a bunch of other people, and if this unlikely but high-risk event should happen to one of you, now the funds are there for you to pay for it. That's what insurance is. The insurance company is the organizer of mitigating high risk for large volume of people. That is not what normal everyday health care is. Yet we've adopted using insurance for this, which is why we have such high costs. That's enough for the moment. If I talk much more, I won't be able to download it to YouTube relatively quickly, so I'm going to cut it off for now. I'm probably going to do this in, I'm going to guess, at least 3 parts. I want to talk about Obamacare. I want to talk about the Canadian healthcare system and its benefits versus its deficits compared to a free market system. I want to talk about a plan on how to get back to a free market system. So signing off from now, Jim Fisher, the Third Way, not left.